Do you experience pain, numbness, or tingling in your wrist or hand, possibly even going up into your arm? Is it getting more difficult to do daily activities such as hold your phone or type on the computer or even buttoning your shirt? In today's video, we're going to discuss what carpal tunnel syndrome is, what are some of the causes and the symptoms of it, when to see your physician, and what are some self-care techniques that you can do at home to relieve the tension in your wrist and your forearm, reducing the compression around the nerve. Before we discuss how to relieve the symptoms of carpal tunnel syndrome, we need to discuss what is going on to cause the pain and the numbness and the tingling in the wrist and the hand. There is a small area called the carpal tunnel in your wrist where a main nerve called the median nerve is fed through, and it innervates a lot of your fingers and part of your palm. So when that nerve gets compressed in that carpal tunnel, it can cause that pain, numbness, or tingling that you feel. And also, it can actually have a domino effect, because if the muscles in the forearm are very tight, especially from typing or looking at your phone or anything where you're grabbing or do a repetitive action with your forearm, those muscles get very tight, and the ligaments that are attached to those muscles end up getting tight, and it can actually start pulling and getting compressed around that median nerve. So everything that's going through this wrist just gets squeezed and squeezed and squeezed to the point that nerve gets affected a lot, and then you feel the pain, numbness, and the tingling. A good comparison for this situation would be a garden hose. As you can imagine, when there is no restriction on a garden hose, the water flows freely and comes out of the end of the hose very strong, very similar to what the nerve transmission does when there's no compression there. So when the garden hose is pinched, you can see that the water pressure gets reduced. And as similar situation, the median nerve, when it's compressed, the nerve transmission gets reduced, leading to the weakness and the numbness and the tingling. So the good news is, unless there is severe nerve damage, by releasing that tension in the forearm, we can again open up that nerve transmission, lessening the sensations that are caused by it. Regarding the symptoms of carpal tunnel syndrome, we've been touching on that in our discussion so far, such as the pain, numbness, tingling, and many times there's weakness where you can't hang on to anything, and it gets a little bit debilitating because we use our hands for so much every day, especially detailed items, such as typing and picking up the phone and different things that we do on a daily basis. If your symptoms are severe, such as severe pain, you're not able to use your hand much at all, or things don't improve despite some of the self-care techniques we're going to discuss, you want to see your physician and make sure to get that checked out so they can help you. Now we're going to discuss some self-care techniques that you can do at home, including stretches and some massage techniques that you can perform on your arm. Now I'm going to demonstrate 2 stretches you can do in the forearms to help loosen the muscles in the forearms to help relieve that tension going down into the tendons to your fingers. You want to remember in these stretches to really listen to your body and not try to overstretch and overforce it, because that could do more harm than good. So you want to work very slowly, especially if it's something you've had for a little bit, because there's going to be a lot of nerve agitation and possibly some inflammation for you. So what you can do is, for instance, when you're going this way, just go 1, 2, 3. And then what I like to do is just bring my hand in the opposite direction. And then 1, 2, 3. You just go as far as the resistance. You don't try to crank it back and really try to stretch it out, because you'll notice each time you go back, you'll go back a little bit farther because you're stretching that muscle, and then come back down, and then you want to go the other way. And as far as how many reps to do that, you could start with maybe 5. It just depends on your tolerance level and how sore you are. The other technique, the other stretch, is going down the other way. This one you want to be very, very careful with, because you don't want to compress too much here in the wrist. So what you can do is grab your fingers and just very, very slowly pull it in, and then just go 1, 2, 3, and you'll feel a very strong stretch that's possibly even going all the way up your arm. And that one actually can cause a lot of tingling as well as a good tingle, because then everything's getting woken up and there is getting more nerve transmission going through the muscle and the wrist area. So, like I say, you can grab your fingers and just very, very carefully stretch. 1, 2, 3. And then if you want, you can do the opposite direction. Come back down. 1, 2, 3. And you can, like I say, listen to your body. If you want to start with 5, I would do probably multiple short sessions throughout the day, especially if you've been typing a lot or using your hands a lot. So that way you're consistently trying to break that pain spasm cycle so it doesn't stay all locked up, and you have that intermittent stretching throughout the day. You also want to remember to do both sides. Even if you have carpal tunnel just on the one side and not the other, a lot of times what happens is our body starts guarding the side that has the pain, and so then the other side pretty much gets ignored, or it has to work double time to make up for the pain or the weakness of the other hand. So then you start getting a lot of overuse with the other arm and hand. So you want to make sure to keep it loosened up as well, doing the same stretches, same exercises. 1, 2, 3, let it down. 1, 2, 3, let it down. 1, 2, 3. 1, 2, 3, and again, be slow and careful and listen to your body. And you might be surprised that there's a lot more tension than you thought in the other hand, just because there's been so much focus on the side that's in pain. You also want to remember to address the nerve. Since it goes all the way up the arm, you want to make sure to stretch the entire arm. Many times, even when there's pain in the forearm, sometimes you'll feel a lot going on in the shoulder as well, especially with typing and anything in the front you're working with your hands. It's rolling your shoulders forward and down a lot of times, so it's also pulling on your neck. There's another video I did to help with shoulder pain, but it also has some great stretches in it that would be very beneficial to also help with the carpal tunnel syndrome. I'll link that at the end of this video and also down in the description. Now let's discuss some self-massage techniques you can do in your forearm, your wrist, and your hand to help relieve some of that tension. A lot of times tension can be affected by trigger points. And trigger points are tight bands in our muscles that when pushed on, you'll feel that they're almost like a rope kind of effect to them, and they can be very sensitive. So when you push on it, the pain can either stay local or, like in this area here, it actually travels down into this area, into my wrist. So what we're going to do is feel for those trigger points, and we're going to work them out. So the muscles, of course, run here, come through here, and just what you can do too is move your hand, and you'll feel those muscles being engaged and pop up. So when you feel that muscle, take your finger and just work it in a circle. And then what you can do too is you can move your wrist up and down. That will engage and disengage it, and it just makes it a little bit more effective versus staying in one spot. So you feel that muscle, and eventually you will feel it, especially if you hold it for a little bit, you will feel it start to release, and the referring area might be less, and eventually you may not feel a pain referring at all when that muscle is detriggered from that point. So then you want to just work down the arm, feel those ropey muscles in your forearm, and then just keep working down. And you can pretty much go about anywhere on your forearm, and there you can feel those trigger points, especially if your forearm is extremely tight all the way around it. And the clients I work on a lot of times have very tight forearms. that often go neglected, especially in massages, but it can affect a lot as far as tension in your forearm. So work the top side there. And then what you can do too is you can come under the bottom, because there are muscles underneath. I'm sure you can see that popping up like that. And again, you'll just work, especially getting close to the attachment of the elbow. It can be very, very tight and very sensitive there. So of course, that's one of the attachments of the muscles is through here. And then of course the tendon goes down into the fingers. So you want to work that again very slowly. And again, it'll feel like a rope, and it could refer a lot down the arm and into the hand. So you just work your way down, and you could hold each point for a count to 5, 10. It just depends more on the give that you're feeling in the muscle. If it's so tight that it doesn't move much, you want to stay there longer. So, and then just kind of keep working towards the inside and across your arm, going all the way down. I'm speeding things up a little bit just so you can see as far as demonstration wise. And just work your way down. What you can do too is when you get on the side like this, you can work that muscle even more. Just kind of squeeze it, kind of like a shiatsu type stroke to it. And then just work it all the way down, just squeezing it all the way down. And then what you can do too is you can also basically strip the muscle up. If you have some good oil like prickly pear oil or avocado oil or a very beneficial oil for your skin, you can put that on and then just take your hand and just squeeze and push up. Squeeze and push up. It's similar to a deep tissue technique, but it's also like a myofascial release. So what this does is it also works into your connective tissue and loosens that up, because there is connective tissue around everything in our body called fascia. And then when that gets restricted, that can also compress and put pressure on the muscles and the nerve, because it's like a sheath that encompasses everything. If you've ever had fried chicken and you go to peel the skin off, there's that white film. That's actually the fascia. And so we have that also around everything on us too. It's pretty much what holds us together. So when that gets restricted, dried out, the fluid doesn't get to it, and that can also cause a lot of pain going from the forearm down into the wrist into the hand as well. So that's important to address that as also. And then again, just strip it from the bottom, come up like that with your hand. And you can, even with this, you can flex, hold, and then come up, because that actually brings even more of a fascial stretch to that area. And then likewise, do this. And you can also, what's very beneficial is actually hold it into the wrist. So hold the top and then just go down like that. Hold the top, go down like that. And that will get into the connective tissue around the wrist. And of course, remember to do both sides, and you'll find one or both will be very restricted, very tight, especially when you use your hands and your forearms a lot. And then eventually you can also start working down into your palm, because there are a lot of ligaments, muscles, attachments, everything down in your hand, especially in this area. This can be very, very tender. So you go in and just like on the forearm, just start doing circles and keep coming up in the fleshy part of the hand. Just keep doing circles. And then start here. You can even get down into the pad at the base and go across that way as well. And then come up on the outside. And then you can work all across your fingers. I'm speeding things up a little bit for demonstration purposes. But just work anywhere on the hand, especially in the fleshy areas that you'll feel a lot of tight knots. Again, those triggers, there's also triggers in the hand, and a lot of bands that you'll feel very ropey as well. So you want to work those out. And again, remember to do both hands. And sometimes too, what I do to stretch my fingers, I'll go in between and then kind of just stretch them apart, which that can help sometimes too. It's similar to what people do when they stretch their toes out to help with bunions and hammer toes. So that gets all the circulation and opens everything up in your hand. Other self-care techniques you can do to help with the symptoms of carpal tunnel syndrome include setting up your workspace in an ergonomic way, such as with an ergonomic keyboard or an ergonomic mouse. And then you also want to remember to drink a lot of water. Without water, our connective tissue, our muscles, everything can tend to get sticky. And we need that fluid to help with our circulation, to help with our fluid flow in our joints. And it's just very important to make sure you're drinking plenty of water throughout the day, especially water with electrolytes such as calcium, magnesium, potassium, because that feeds into nerve transmission and muscle contraction as well. You can also use things such as wrist braces, and kinesiology tape has also helped some people as well. It's also important to be mindful of our posture and to get out and move when we take those breaks, getting that circulation going and also getting that fluid in the joints, especially in the shoulder, elbow, and the wrist. So it helps with that stickiness and stiffness and gets that movement flowing, so that way it relieves a lot of that pain and pressure. If this information has helped you, feel free to like and subscribe and stay tuned for more self-care tips.